Good afternoon, everyone. Welcome to our webinar today. I'm Erica Jones, vascular neurologist at UT-Southwestern in Dallas, Texas. Welcome to today's webinar. This is organized by CONNECT. CONNECT is the collaboration to improve outcomes, preventive care, and care transitions after stroke. Today's webinar is titled Food for Thought, Nutrition, Brain Health, and Stroke Prevention, on the topic of Food is Medicine, which is an initiative that integrates healthy nutrition into clinical interventions to reduce disease and improve outcomes. Today, specifically, we'll be talking about food is medicine as it relates to brain health and stroke outcomes. I'll be with my co-moderator, Dr. Aparicio, will be moderating a panel discussion with our experts here, whom you'll meet shortly. But there will be time at the end for questions. So please enter questions into the Q&A box, and we'll incorporate those questions as we're able. This webinar will be recorded and will be made available through the CONNECT website. Now I'll introduce my co-moderator, Hugo Aparicio. Hugo.
Hello, I'm Hugo Aparicio. I'm an associate professor of neurology at Boston University. My research focuses on preventive neurology, focusing around prevention of stroke and dementia, and study of lifestyle risk factors, vascular risk factors that contribute to brain health. Very pleased to be here with the CONNECT group, and happy to help co-moderate.
Thank you. Thank you, Hugo. And now Jessica Hooke.
Hi everyone. My name is Jessica Hooke. I'm a speech language pathologist and clinical specialist at Orlando Health. I serve on our inpatient rehab team. I hope to bring some insight from my perspective, focusing on working with patients who have dysphagia, COG, and language disorders due to their stroke. I also am the one who created the Neuro Friendly Restaurant Initiative, which is a grant-funded program to provide inclusive environments to spaces for individuals in the community in a restaurant setting. I will talk hopefully a little bit more about that later on during the discussion. I also helped to collaborate and create launch our ITSE, which is looking at our standardizations for dysphagia in-house at my company. So I'm glad to be a part of this conversation.
Thank you, Jessica. And next I have Dr. Laurel Cherian.
Hi, good afternoon. My name is Laurel Cherian. I'm a vascular neurologist at Rush University Medical Center in Chicago. And I have a research interest in food as medicine, specifically the role of the mind diet in preventing cognitive decline and dementia post-stroke. And we're in the middle of a clinical trial doing delivered meals to our stroke survivors and tracking outcomes on that. So I'm very excited to be part of the conversation today. Thank you for having me.
Thank you, Laurel. And next, Daphene Altema-Johnson. Oh, you're muted.
Sorry about that. I believe it's good afternoon. My name is Daphene Altema-Johnson. I am a registered dietitian, researcher, educator, and entrepreneur who works at the intersection of nutrition, chronic disease prevention, and healthy sustainable diets. My work focuses on translating nutrition science into practical strategies that help people use food to support health and recovery. So I'm particularly passionate about making nutrition guidance equitable, culturally relevant, and accessible so that healthy eating is realistic for the communities and patients that actually we serve.
Thank you, Daphene.
You're welcome.
Next, Layla Colon.
Hello, pleasure to meet you all. Thank you for having me. I am the proud owner of the Smoothie Room, which is a participant of the amazing initiative that Jessica created to provide neuro-friendly options for survivors in the community. And I am also a former caregiver for a patient. Would love to share how this particular programs have tremendously helped our community and my family.
Thank you, Layla. Thank you to all of our expert panelists for joining today. I'll open the discussion with a question for Laurel. So the first question that we'll start with is, there are some different diet recommendations, especially for people with stroke. Many may be most familiar with the Mediterranean diet, as that's the one that's very commonly recommended and is mentioned in the stroke guidelines. So many physicians are familiar with this one. Can you talk about some of the different specific diets that are recommended to stroke patients and maybe talk about the differences between things like the Mediterranean diet or DASH diet or MIND diet?
Yeah. So the Mediterranean diet probably has the largest amount of published research on it. And if you think of like the Predimed study out of Spain, that was one of the big clinical trials showing a benefit for doing diet interventions focused on that. The DASH diet has been around a long time as well, really focusing on low sodium. And then the MIND diet, which is kind of what I'm studying, has components of both the Mediterranean and DASH diets, but then with an added emphasis on certain what we call superfoods. So dark leafy green vegetables, berries, which are rich in antioxidants. All of them really have this emphasis on the sort of fruits and vegetable component, whole grains, and then limiting the saturated fats. And some of the other unhealthy items. The thing that I want to kind of comment on, because I do get this question a lot from my patients, is, less so a fixation on the nuances between Mediterranean, DASH, MIND. You may hear of the prudent diet and sort of the subtle differences between them. I think for most Americans, really the question is more a Western style diet, which oftentimes has a lot of fast food and processed foods and is the way that a lot of Americans tend to eat versus any of these healthy diets. So, if you're really agonizing between which one of these is the best diet for me, I would say pick any of them as opposed to the traditional Western diet where there's just a lot of ultra processed foods, a lot of high sugar, saturated fats, and trans fats. The MIND diet for me, where I got interested in this, was really trying to look at specific nutrient components and foods that are really nutrient dense in those elements that have been shown to support brain health and brain recovery after stroke. And when I first started doing my research, my mentor was a nutritional epidemiologist at Rush, who was looking at neuropathology and actually more Alzheimer's disease and prevention of Alzheimer's dementia. And then when we started collaborating and looking at these frozen brain specimens, my question was, well, let's look at the people who've had stroke. Let's look at vascular neurology and see if these healthy diet patterns, particularly the MIND diet, has a benefit in stroke survivors.
Great. I was hoping we could talk with Ms. Altema-Johnson about resources for patients and caregivers of stroke patients, because many patients are going to look up these diets online and they're going to look for nutrition advice for stroke survivors or people preventing further stroke. How do you identify trustworthy information? Are there specific resources you recommend?
Yeah, so that's actually a really good question because the internet can be a helpful resource, right? But it also can be overwhelming because nutrition misinformation is actually incredibly miscommon. And unfortunately, the wellness industry period has a lot of pundits or imposters, what I call people who actually talk about a subject with like great confidence. They're great, but they are not trained in the field. But they're the one who making the money, who are pushing that, and they tend to get a very large audience. So when I guide patients, I encourage them to look for information that have three components, right? They are evidence-based. They are written or reviewed by healthcare professionals. You can see that when you're reading something, you'll say review by so-and-so, dietitian or an MD or so on. And also they are associated with reputable organizations. So who are those sources? What are some of the reliable sources that I recommend? The first thing is the American Heart Association. They have amazing resources for caregivers, for providers, as well, as patients. The Academy of Nutrition Dietetics, they actually have, again, education, information, and nutrition information per disease state. NIH, is a great resource, for the DASH diet, which Laura recommend. You have the stroke recovery organizations, which actually provide patient education, as well. I think stroke.org actually has some good information on them. But the thing is that we're seeing right now is artificial intelligence. Everybody, like those platforms like ChatGPTs, it's a thing. And I hear you, it's a thing, but you got to know how to use it. right? They can be useful in certain ways. I'm not opposed to it, but the way I see them used is maybe to summarize, general nutrition information that you may or not understand. You can ask it to say, hey, can you explain this to me in a way that, as palatable, But however, AI should not be used as a substitute for professional medical advice. We're just simply not there yet. And nutrition recommendation itself is, for me, and as a dietitian, as a practitioner, when I make recommendation, it often needs to be personalized based on someone's health conditions, their medication, and lifestyle, which is why working with healthcare professionals like yourself, and a registered dietitian is still essential. So I see technology as a tool that can support education, but not replace individualized care, if that makes sense.
That's great. Before we move on from the topic of these sort of specific diets, there's a great question that was just added to the Q&A box. So I'll pose it perhaps both to Laurel and Daphne. And the question states, can you talk for a bit about protein and the role of high protein in brain health, the impact of focusing on protein versus on fruit and vegetable consumption?
So I'll take a stab at that. I think you have a little bit different goals with both of those nutrient recommendations. So fruits and vegetables are really high in vitamins and minerals and fiber, which are all really important and are going to achieve various results for you for brain health. Protein is really critical, and especially for a stroke survivor, for building muscle mass and also for some of the metabolic health and sort of blood sugar levels, as opposed to eating more carbohydrates. And so both of those things are important, but for different reasons. And the other point I want to make about protein is that, especially in some of the younger age groups, it's become really popular to sort of hyper supplement protein and using these sort of powders and shakes and really adding large quantities of protein. And you may have seen in the news a number of months ago, there was a fairly big story about finding significant levels of lead in some of the protein powders on the market. And it serves as a good reminder that the entire supplement industry, including protein powders and collagen and all these other things, are very loosely monitored and not really regulated at all by the FDA. And so they will often market themselves as sort of a nutraceutical or in the same way that a prescription drug is. And the presumption is that there's that same level of safety and scientific rigor and testing behind the supplements. There is not. There's sort of loose guidelines that it should be what they say it is. But there have been multiple studies where there's been issues with contaminants and sort of purity levels. And so for most of my patients with protein, if that's the goal, getting them from natural sources, things like lentils, beans, if you eat animal sources of protein, chicken and fish, are going to be much better for you than necessarily buying sort of powders or supplements.
Yeah. And I'll add, it's interesting. Protein is having a way for, like, it's been all over the news, and I've written op-ed about it as well. It's everywhere. And that's where we are right now, right? Because the Dietary Guidelines for Americans just published this upside down pyramid that you see, that a big fat steak is there with whole milk and so on. That's what we're promoting. That's what we're seeing. It's all over the place. Does that mean protein is bad for you? It is not. But I like to talk about not actually the molecule as much as I like to talk about the protein package, right? Not all protein is created equal, first of all. And when we think about as it relates for brain health, is incredibly important. So I'm just going to throw some terms out there that I think it's important, which actually Laurel covered on actually very good. When you think protein in its simplest form is amino acids. Amino acids provide neurotransmitter production. Why is that important? Because that's important for your brain, right? They're the chemical messengers brain cells use to communicate. Also, these neurotransmitters are good for your mood, focus, and motor control. So when you're talking about, stroke, motor control is very important. And Lois said it, an important role is repair and recovery. So again, depending on the individual, again, individualized nutrition, we determine how much protein that you need. But protein is not something that I always go back to the dietary pattern. You're not eating one thing, right? Nobody eats just one thing. It's a pattern, the way you eat. It's a lifestyle. And so going back to, she said, the most important thing is that you want to have a dietary pattern that actually has plant sources, animal sources, right? Because when you have plant sources, as was what recommended from the dietary guidelines, the committee of experts, amazing people around the world, they actually decided to put beans, peas, and lentils at the beginning as the recommendation. And that is for your health, for your brain, followed by seafood, followed by meat. And there was a reason for that, right? Because again, it's about the protein package. Proteins are not bad, but protein should be, Americans don't have a protein issue. Let me say that. We actually have a fruits and vegetable issue. We don't consume enough fruits and vegetables, and we certainly don't have nowhere near enough fibers. So if you consume beans, peas, and lentils and diversify, focus on the package, you have a higher chance of meeting your recommendations than if you just focus on one type of protein.
Yes, wow, that's so interesting. Especially in the current debate and how much it's having its moment. But this segues really nicely into discussion with Jessica Hooke and Leila Colon about kind of like boots on the ground. How do you actually get your nutrition practically? And so, like, starting with Ms. Hooke, are there any resources you recommend to stroke survivors that say might live in a food desert and they're trying to seek these healthy food options? What kind of recommendations or strategies do you start to recommend other than going to Ms. Colon's restaurants?
Yes, which is a great restaurant, of course. And that's a multi-layered question. Honestly, I'll start it. I would love to hear my colleagues and their recommendations too, because we all live in different areas, and that's where I will start. It really is community based. Every community is different in terms of the resources. In terms of I always talk to my patients, and I have a unique place where I get to apply so many things. I work very closely with a dietitian on our team, especially when it comes to dysphagia, and I get to see what people are bringing in into the rehab room, because they'll bring in the foods and sneak things in. So I kind of get to see the diet, and I get to start collaborating, and that's when I start bringing the dietitian in and kind of reinforcing those good behaviors slowly. The first thing I go to before going anywhere else is the easiest thing is, if possible, and I know this is challenging, is to prepare the food at home. And we can always talk about modifying the foods and how that looks. In terms of food deserts, I'm not going to paint a false picture. That is a gap, and there is need still being to be made across the nation. However, there are some unicorns in the community in terms of places to go. Food pantry is one. Now, in terms of that, obviously we know that sometimes they're not packaged with the most healthiest foods, but some places like Second Harvest are now packaging heart healthy boxes. Just depends on the community. There are other community based organizations like where I live who have food buses that go into certain communities, and looking online and just typing in food bank buses or food banks in my neighborhood and typing in your area might bring up some things where they provide fresh produce and the fruits that we're discussing. Community gardens, which are starting to become a little bit bigger, is another place to go to and get access. And when I say this, I also know that transportation is going to be a barrier. And so with that being considered, are places that will deliver to the door. So that's another option too to consider. From a dysphagia component, there are some places that will actually deliver foods to you across the nation. One is Dysphagia Outreach Project, and they will deliver modified foods to the individual's home. For people who need assistance, who may be struggling with finances too, they do also provide that. And so those are some of the places I would start. But again, I would say these are places that really truly are community based. So I would love to hear what might be going on in Chicago and the DC or the DMV area, and maybe some other suggestions too. Because I think collectively hearing what other communities are doing helps to build a picture. Okay, this is where I can go.
Yeah, so Ms. Colon, what's been your experience with stroke survivor education on nutrition?
I have actually a very unique experience. I was a caregiver at one point. My mom visiting me, well, she was visiting me, she had a stroke. She happened to stay at Orlando Health for a very long time and then went through the rehab center. And that's actually how my conversation came about with Jessica. I was blessed to cross her path, and we were able to put this program together. And so as an actual caregiver, my biggest struggle at the moment was not knowing what to feed my mom and what I didn't have enough resources. So the fact that now the hospital is putting in place more guidance and places like our shop that actually provides design menus for different types of wellness. So we have a heart-friendly options, we have brain-friendly options, and we have low blood sugar options. And we hope to continue to grow that. But having those resources available in the community for me are even more valuable than anybody else because I was a caregiver. So I understand what it is to come home with a patient and not know what to feed them. And so we continuously work with Jessica to try to bring more resources, try to make it more available, more accessible, and to add a little bit to what the doctor was saying earlier. We understand that there's the majority of Americans don't consume enough fruits and vegetables, and a smoothie is a perfect way to disguise them, if you want to call it that, or make people that maybe have some more sensitive palates actually consume them in a more delicious and easier way to intake. And so for us, it has been a blessing in two ways. As a business, we want to provide for the community, but because I already went through the experience, I would love to provide that guidance to others as well.
That's great, Leila. Just to build on that, and maybe since you were mentioning about the use of smoothies, I'd like to direct a question back to Jessica, specific to a lot of our stroke survivors are dealing with dysphagia. And so having difficulty with like the texture of diet that they're able to be able to eat. So what kind of recommendations do you give to these patients who are having to modify their diet while still trying to maintain healthy nutrition?
Yes. So one thing one resource I would just want to plug in there is the American Heart or American Stroke Association has a cookbook, and they have foods on there that they show how to modify it for each level. So if you're in the hospital or if you're discharged and you're still in rehab or you're on a modified diet, you can tell from based on your stage where you're at how you need to modify that basically in the kitchen. Personally, I will say, because I had my aunt had a stroke and had dysphagia and aphasia, and was the cook of the family. So, and I helped her out quite a bit. So I've experienced this on the other end of how hard it is to modify it. So I will say a lot of times it is very challenging. What I typically like to recommend, like I said before, is starting with what you have. Oftentimes I will ask the caregivers to bring the food in, and we can try that out during a session, and I can show them how to modify it. Really, very basically. Currently, we are now using what's called the International Standardization for Dysphagia Diets, and it's pretty much what that is. It's a way of simplifying all the intricacies of how to modify a diet when you get home. So instead of just saying soft, now we say think of diced carrots when you cut it up. If you can smash it, that's modifiable. If it just cracks, then it's not. And so being very basic in terms and using that as a resource online, it would be IDD, I think is, yeah, iddsi.org. They have a load of handouts to show you, and they'll actually show you the square, how to cut it. They also, oftentimes, if you look into other resources, they have a cutting board that they often will provide for people to actually know how to cut and modify the foods at home. So those are some ways to go about it. It's becoming more accessible online too. Amazon now has some items online too. So if you know, again, asking your healthcare provider, especially your speech pathologist, what diet you're on to correlate and make sure you're looking at the right item or the right number, because ITSE goes by number based and color coded. That will help you to know, okay, this food item fits under there. That's still a place to grow in terms of what's out there, but those are some basic places to start.
Terrific.
Can I add something to that?
Yes, please.
And Jessica, don't kick my butt.
No.
This is some of that, again, this is from a practical standpoint. And this is my work in as a clinical dietitian and rehab in nursing homes. And this is the thing I see. Now, Jessica's job is to make sure the patient is safe, right? That is her job, to make sure that they're able to eat in a certain way. Me, as a dietitian, I come in, I see their plate, I'm like, who's going to eat that? So a lot of times it doesn't look good, right? And so the challenge I see is for puree food, they're less visually appealing, right? So, but when you think about the way people eat, the first way people experience food is through what? Your eyes. So if a meal doesn't look appetizing, you think I'm going to eat it? No, ma'am. Because what we, and that actually contribute to what we see in a nursing home, is then we start dealing with malnutrition issues, right? So I encourage, and sometimes I can do this in the kitchen, especially depending on the nursing home you are, but I encourage like creativity in some of the food preparation. So if it's a food that they're familiar with, you can mold it in the shape that they're used to, or just something fun so they can at least taste it. Right. And then you can get to be like, and a lot of times it's like, I'm like, come on, I'm just talking to them, playing with them, and I put the food in their mouth, and then they're just like, I said, how does it? It's not that bad. And they just go ahead and tear that sucker up. But some of it, they're just like, no, I'm not touching it. But it's very important too, when we think about that, they're still human beings that has their, their senses, some of them, not everything goes away. And so thinking about the appearance, the color, and making seasoning and making the plate still look good is actually, important as well. Just my 2 cents.
And Daphne, I'm not kicking your butt. You're actually 100% right. And I will say, that's why I say start with what you have, because sometimes I will cut and manipulate the food in front of the patient so they know it's real and it makes sense to them. So no, I'm 100% with you. I loved how the food tastes. So we're on the same page.
As a parent of 2 little children, I can attest that presentation is very important. Otherwise, it won't get touched.
Yeah.
Another question that's come up in the chat is really pertinent to all of this, which is, amid all these practical considerations and dietary advice, we totally recognize in Boston, Chicago, Orlando that culture and family are very important, influencing how diet and nutrition are approached. And in addition to education, how are we ensuring that families are changing their behaviors around eating, especially when the behaviors are established and reinforced over many decades, or in some cases over many generations? So this is a question I'd like to put to Dr. Cherian about cultural considerations and how to realistically implement all this advice.
Yeah, I think it's a really important question. And, in Chicago, we're a very diverse, multicultural city. And so we have people from all different backgrounds. And in our clinical trial, Nourish, we specifically partnered with a company that was minority owned and willing to work with our dietitians and go in and not just have meal choices that hit the dietary nutritional components, but actually hit different flavor profiles as well. And so somebody who really likes a lot of spice may find the Mediterranean diet a little bland for their palates, right? And so to be able to adjust those dietary recommendations to different flavor profiles, but also different geographic and regional preferences. So if you look at some of the literature that comes out of China, some of the fruits and vegetables that we emphasize really heavily here just are not grown or not widely available in other countries. So then the question and the challenge becomes, well, what in your grocery list, what in your culture's fruits and vegetable kind of stable of foods would hit these nutrient components, but it's something that you're familiar with, your family is familiar with, you can put in your family recipes and adjust to be more healthy. And your comment about not just the patient, but the home that they are living in is so important, because there is no point in me doing food as medicine, a delivered meal, or having a dietitian coach a patient on how to eat according to the Mind diet or the Mediterranean diet if 6 o'clock rolls around and they order a pizza and everyone else in the family is eating deep dish pizza, and then my patient's going to go and have a spinach salad with some salmon on it. It's much more likely to be successful if you can move the needle and make some of these changes and have the whole family evolve in a way that they are making these changes together. And your comment about having little kids, Nobody wants to cook one dinner for the kids and then one for the adult. Nobody's got time for that, right? You want to be able to cook one thing that everybody in the family can eat, that they're going to be, that tastes good, that gets the nutrition in, but you're not cooking multiple meals multiple times a day for multiple different people. You've got to find something that's cohesive and that works for the family.
Yeah. And I would like to add too, when we talk about nutrition and healthcare, it is important to remember that food is deeply, deeply, deeply connected to culture, family, country, traditions, and daily routines. And I don't play about that. So if we recommend dietary changes that ignore these factors, they're very unlikely to be sustainable. And that's what I've seen time and time again with clients that works with dietitian that just basically, as exactly as Dr. Cherian said, hey, practice Mediterranean diet or do this, do that. And they're looking at you like you're stuck on stupid because there's like, this is not what we eat. And they're all right. So as a dietitian, from a practical perspective, and if you guys are working with a dietitian as survivors and caregivers, the first thing they should try to understand is what people are already eating. How is food prepared in the home? What foods are meaningful to them culturally? Who is preparing the food? So instead of asking them to abandon their culture, which is a lot of times what health practitioners do, they don't think about that. The goal is to get them to adapt, right, their own foods in ways that support their health, right? So you're not changing their flavors. Sometimes you got to tell them, well, you can't add too much of that. You got to add a little bit of that, and that's okay, right? Because what we do know is that small changes over time leads to bigger changes and have greater impact. So you can adjust portion size, you can modify the cooking methods, as Dr. Cherian said, but just understand that we do know the research shows that knowledge does not always translate to behavior change. So people need strategies that actually fit into their real lives, considering time, costs, family preferences, and access. Access is a big thing. And so we want to respect their culture and we want to fit it within their lifestyle. That's where you're going to get more bang for your buck there.
Can I add something to just real quickly with that too? I also believe it starts early on, and I'm talking for healthcare providers here. It starts early on the care, because if we can have a multidisciplinary team saying the same thing over to the patients and their caregivers while they're present, you're going to be easier to establish that rapport and to guide them the right way. Sometimes they leave and they don't have that access to dietitian. So if we are encouraging and being that voice and telling them about dietitian, telling them accessibility, and that is not as hard as what they think it is, bring them into the picture early on, and even collaborating. Like I said, I love collaborating with my sister's a dietitian too. So I love collaborating and exploring and talking about these things. And from someone who's dealt with this, from a cultural standpoint too, with my own aunt, you have to start early because you're going to lose them later on down the path.
If I can add something to that, obviously Jessica and I collaborate and we work with the nutrition team, but I think the good news is the market has expanded so much that there are a lot of the traditional foods for different ethnic groups that have expanded into more healthier versions of the same foods. So we at the shop are currently implementing, to give you an example, Spanish people love empanadas. So we found a way to providing empanadas that are going to be baked instead of fried, and the crust is made with yuca instead of flour. So I think that we got to take advantage also of the resources, but informing the patient early on, like Jessica said, is key, because most people don't even know where to start.
Thank you all. That was great. For the next question, this question is for Daphene. In addition to some of the cultural changes that need to be adapted to for the diet, many of our stroke survivors are also managing several medical conditions and comorbidities. So they may have hypertension, diabetes, high cholesterol, in addition to now having a stroke. So how do you advise these patients when they have to adapt their diet for multiple different constraints, low sodium or low carb, or all of these different recommendations? Because what I usually hear from our patients when we talk to them is, I can't eat anything. So what do you tell these patients when they're overwhelmed with all of the dietary changes that are required?
That's a good question. A lot of time, the first thing I tell them is that I reassure them, you don't need to eat a different diet for every condition. That can feel, as you stated, incredibly overwhelming. And the encouraging news from research is that many of the same dietary patterns that help address risk factors, you're looking at blood pressure, diabetes, cholesterol, stroke risk, all the things that you guys have mentioned, work the same. Like, they're effective for just those things. So instead of focusing on restrictions, which is very important, if you want somebody not to do something, you tell them no. So instead of focus on that restriction, I focus on overall dietary pattern, particularly patterns that Dr. Cherian talked about, like the Mediterranean diet, the DASH diet, which are strongly supported by research for cardiovascular and brain health. But also going back to the patterns, right? The pattern that I want to talk about, what's emphasized, is more vegetables and fruits. Right? That looks different for everybody. Some people, believe it or not, they haven't tried certain fruits, and that's okay. You meet them where they are. Whole grains instead of refined grains. What are refined grains? Your white bread, right? Healthy fats. I'm talking about olive oil, nuts, and seeds. That's what I'm talking about. Lean proteins, fish, beans, and poultry, right? And like you said, as you stated, reducing excess sodium in highly processed food. And sometimes they get overwhelmed because we said, you can't have any sodium, you can't have any salt. Well, no, that's not realistic. No, 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 no. So we got to slowly decrease it. And then that's one thing we can do. And sometimes with obesity, they recommend for them to lose weight. And that's fine. We focus on those sustainable changes rather than rapid weight loss or drastic dieting that doesn't work. So as a dietitian, my role is really helping patients to prioritize the few changes, that may be 2 to 3 changes, that will actually have the biggest health impact, rather than asking them to change everything at once. Right? We design goals. What are we going to work on? And it's like it's a relationship, right? And it's important that they feel they're making decision that is, important in their life too, especially after something that's happened. It's a relationship. What are we going to work on? What's important? They help you pick those 2 changes that they feel like they can make, and you start building on that. And again, going back to the last question, I also want to emphasize that food should still be enjoyable and culturally meaningful. A lot of times they think they're losing that, and again, sustainable change happens when the diet fits into someone's life. And that's what ultimately that will improve their health. So that's what I will say to that.
That's so, it's great to get all this expert advice from every angle about how to do this. But flipping it, asking Leila Colon about this from your perspective as a caregiver and a person that's thinking about this for her business as well. What support could do you see that the healthcare system can provide stroke survivors and families in improving their nutrition in all of these ways we've discussed?
I can tell you that it would be resources and information. When my mom was released, I was told her life changed, obviously. She went from being a completely capable, independent person that was actually traveling on vacation to not being able to be alone at all. And so the first news was, you need to make sure that she's taken care of 24 hours a day. And the second is, she can no longer eat the same things that she was eating a month ago. And so my initial reaction was, okay, I'm an executor, I'm a solutions person. What do I have to do? And at the time, the hospital didn't have as many resources as they do today, thankfully. And so I was sent home with my mom. I was a single mom with a 1-year-old and not knowing what to do. So I think having information, it's 100% what anybody that's going through that situation would want. Aside from, all the other things that they're going to need, but information helps, with guidance and also with the anxiety that is created by the situation. And so we love, contributing to that factor, but I think, it's in very baby steps right now. It has to grow, these are efforts. And luckily I live in downtown Orlando. We have a lot of resources, but I can't imagine somebody that lives in an area where they don't have access to these resources.
Thank you, Leila. I think, many of our patients express a similar sentiment of needing more resources And often many of the things that we give them during the inpatient hospital stay, it's kind of an avalanche of information and it's not really as helpful. And so perhaps many patients are asking for sort of a touch point after discharge to get some more information when when things have sort of settled down a little bit. And this is a role that I think many people are referring to a registered dietitian. And so for Daphne and for Jessica, what is the role of the registered dietitian playing in post-stroke care? And how is that different from a nutritionist, which is, another term that is often used when we're seeking more expert advice? And what is the role of these two? And does insurance cover, which is something the patients are often asking, can I even get access to a dietitian with my insurance? So what's been your experience with that?
Oh, you want me to start, Jessica? Okay. You're talking, Jessica. I don't know if you were starting, if you wanted me to start. Should I?
Go ahead, start. I'm sorry, I meant to go ahead.
Okay, then that's good. So that's actually another really good question because the term nutritionist can mean many different things depending on someone's training or where they live. So I say when somebody said they're a nutritionist, put an asterisk next to that. As opposed to registered dietitian, nutrition, or NDN, that itself, that degree, that credentialed is credentialed healthcare professional who has completed a certain type of academic work, which means they went to a university program in nutrition. They had supervised clinical training. They had to take a national credentialing exam. They have to do ongoing continuing education, CEUs, to stay up to date with the information that's out there. So, but they are trained to specifically provide medical nutrition therapy, which means that they use nutrition as part of disease management. Now, for stroke survivors specifically, dietitians help patients manage the condition that often contribute to the stroke risk that we were mentioning, like the hypertension, diabetes, high cholesterol, kidney disease. So we work with patients to translate that nutrition science into practical strategies for everyday life. Now, in terms of the insurance part, insurance coverage, most insurance plans, honestly, now that I see, covers nutrition counseling for medical nutrition therapy or MNT for certain condition, especially diabetes, heart disease, and chronic kidney disease. But that coverage itself actually was mandated by the Affordable Care Act as a preventative service. So that's actually a good thing. But that doesn't mean you can't get it, right? So coverage usually, I will say, require a physician referral. So you have to be referred. And there's typically a limit to the number of visits, that's covered each year. But you have the major insurance providers like Aetna, Blue Cross Blue Shield, Cigna, United Healthcare, all of them typically cover these services. Just make sure that the dietitian is in network to prevent like a lot of out-of-pocket costs. For Medicare and Medicaid, it's a little different. Medicare covers MNT for diabetes, renal disease, or post-kidney transplant with a doctor's referral, right? But Medicaid coverage is all over the chart because that varies actually by state. So that's different. But what I'm seeing is as healthcare continue to recognize the importance of, the whole movement as food as medicine, we are actually now seeing this growing integration of nutrition services into patient care, which is really wonderful.
Yeah, and I think that you did a great job. I have really not much to add from there. But I believe most people right now on this call are in the outpatient setting, so I believe what you said is most relevant. So I really don't have too much to add from that point.
I just want to make a comment on this because, I'm a stroke doctor. And so obviously spend a lot of my time on call in the emergency room, telemedicine, robots and things like that. Systems of care for stroke in the US have really advanced a lot and revolutionary treatments, clot busting drugs, mechanical thrombectomy. We can pull a clot out of your brain and save your brain. And so the hospital side of things is really well structured, really built up, really well supported. And I think we take excellent care of patients in the moment acutely when they're having their stroke. I would love to see the US move to that level of structure and support for our stroke patients as they transition out into the community and back home and had that amount of intentionality and resources and personnel to follow them after they leave the hospital with that same level of intensity that we have while they're in the hospital. And, I don't think that's there yet. And Daphne's comment about, whether you have Medicare versus Medicaid versus private insurance, and it's a little bit of a Wild West about who can access what and when and how they have to get it in place and how long they're going to have access to that. And it's such a critical thing because all of these vascular risk factors are rooted in nutrition, are rooted in lifestyle. And so to do all of these really expensive, really miraculous treatments and interventions in the hospital, it's like rearranging the deck chairs on the Titanic if you go back home and you don't change the root causes of why this happened in the first place. So, I would love to see more structure and more support for following our patients out in the community after their strokes.
Fantastic, Dr. Cherian. I totally agree with you. It feels like we put all these resources into this little sliver of time that we have access to these patients, and the before and after is like 99% of their lives, it's like neglected.
Yeah,
So,
like released into the wild is how it feels sometimes. Yeah.
And addressing the importance of all this, the follow-up for you is, we haven't really discussed how does nutrition affect post-stroke recovery and outcomes. I mean, we talk about brain health as such a broad topic now, but why is all of this so important specifically for the stroke patient?
So one thing for sure to be aware of is that after someone has a stroke, their risk of dementia doubles compared to somebody who has not had a stroke. And you've probably seen all these fancy Alzheimer's treatments that we have now. If you are a stroke survivor, you're not eligible for the treatments for dementia. They're not safe. You're more likely to get brain inflammation or brain hemorrhages as a side effect of those medications. So we're very limited in what we can do to treat cognitive impairment and dementia after a stroke. And one of the few things that we do have evidence can be helpful is diet. And that having a healthy diet and shifting the body over to this anti-inflammatory state. You may have read things about the gut microbiome. You may have read things about BDNF and interleukins, these sort of inflammatory markers that circulate in the body can be lowered and shifted to a safer profile when you have a plant-based diet, a healthy dietary pattern. And inflammation can be a big driver for cognitive decline and dementia and developing that. And that research is still evolving, but it's pretty clear that people who have a healthy lifestyle, both diet and physical activity, exercise, sleep, really the whole profile for lifestyle, are at a much lower risk of getting cognitive decline and dementia than people who have an unhealthy lifestyle. And so for stroke survivors who are a fragile at-risk population for this, it's especially important that we be aggressive about diet and about these lifestyle interventions in stroke survivors and really making sure that we're optimizing things for them to put them in the safest kind of trajectory possible after their stroke. And that's true of other things like motor recovery and mental health outcomes. I think there was a question in the chat earlier about, stress and anxiety. All of these biomarkers that are linked back to nutrition, having this healthy diet pattern can actually improve your cognition. Daphne mentioned some of the neurotransmitters, right? The building blocks for serotonin and dopamine, the chemicals in our brain that make us feel happy and calm. All of these originally come from a lot of the nutrient and dietary sources that are in a healthy dietary pattern.
Thank you. This is such a great discussion. I have a lot of interest in the social determinants of health aspect as it relates to post-stroke care. And one of the topics that comes up a great deal from our patients is that, and we kind of touched on this with the food deserts, is also just the expense of these healthy diets, healthy foods, produce, things like that tend to be more expensive. So for Daphne and for everyone really, what are your thoughts about how we advise our patients and stroke survivors and caregivers who are trying to navigate some of these economic barriers when trying to improve their diet, and what are like some of these practical strategies that they can actually implement in getting access to these foods?
Yeah, it's true. It's sad because I attended a national food policy conference last week, and it was really sad because when you see the prices of food, how much have increased since COVID is it's astronomically. And realistically, many families are still feeling that pressure, right? Though it's hard, but at the same time, it's important to acknowledge that, they're very real for them. Especially for those many individuals with lower incomes, right? So those with lower incomes, highly processed foods are often cheaper and more accessible than healthier options. And for stroke survivor, specifically, you have loss of income and employment, you have transportation and access issue, you have for them lack of insurance coverage, which you talked about. And also, I remember when I was one of the last conference Dr. Sharif had, one of the survivors was talking about, devices, how expensive they were, so some of them because their mobility are affected. So yes, access is a major issues, because some people live in areas without neighbor supermarkets, which is harder, to purchase fresh food, but there are things that you can do. And so, for example, some of the things that I recommend that are affordable, that are practical options is frozen vegetables, which they are nutritious and they are less effective. I mean, less expensive, I'm sorry. Beans and lentils, they are affordable sources of protein and fiber. As a matter of fact, that should be in your shelf for like rainy days. You should always have cans of beans and lentils in bags of that. That's a very easy thing to grab and do, and it's very inexpensive. We talk about a lot about the omega-3s, how important they are to your brain health. So I'm talking about canned fish, tuna, sardines. They have very good, they're healthy, heart healthy omega fats, fats, fatty acids that have omega-3s. Simple whole grains. You're talking about oats, right? Ground rice. Those are some strategies that I use with clients on basically how to mitigate, price when price and cost is an issue, and it's real. And also, I like to teach them too about a plate. Sometimes they get defeated, right? Because they're dealing with a lot of issues emotionally, socially, etc. Just think about, I tell them, what does a healthy plate include and how does it look like? And I said, vegetables, whole grains, and your lean protein. And sometimes they ask about the fat. I said, well, be careful with the fat you cook the lean protein in, but you can have fat, but that's a healthy plate for them. And that's what they should kind of aim for. And you don't need to go to the store and get fresh produce. I mean, it'll be nice, but a lot of people don't know the way you cut costs as well is to shop in season. Foods that are in season are going to be less expensive than you buying strawberries if you live in Maryland, for example, in November. You have no business buying strawberries in November, right? Because it's going to be $8, $9 as opposed to waiting until May in Maryland to buy it where it will be $3.99. So different things like that are, shop in season, look for sales, and use frozen vegetables and etc. to just actually buy it, and they're just as good. There is nothing wrong with that.
And Ms. Colon, addressing this about cost and about access, what community initiatives would you like to see implemented to improve nutrition?
I personally would love to be able to allow patients to use FSA and HSA accounts to pay for healthy foods. And it is something that I'm actually researching to try to do. I think a lot of people even lose those benefits because they don't use them at all. And it would be a way for them to give them access to things they need. Obviously, it's something very new, but in our case, we just understand what you just described. And so our shop, it's focused on all nutrition. So we don't use any syrups, nothing artificial. We don't even use ice in our smoothies. And because we focus on the nutrients, everything is more expensive for us. We use a lot of organic, clean products. And so we are a little bit higher priced in the market. But what we did, particularly for those patients, is we created a smaller size, with all the nutrition facts that they need to be able to give them more access. And we're currently working on monthly subscriptions for people that need to have certain nutrients every certain days or every day, every week, frequent buyers, frequent eaters. We will be launching a subscribing program, but we understand, our product, because we keep it so natural and clean, tends to be a little bit more expensive. So I'm currently trying to partner in the community, trying to get vendors to get on board with different programs. And like I said, my dream would be to be able to partner with the healthcare insurance side of things to provide, because as you say in the beginning of this conversation, food is medicine.
Those are some really great ideas. I love those. Thank you for sharing those. I think I just want to say a reminder, if any of the viewers or audience have any questions, please feel free to put them in the Q&A box. We'll, continue the discussion, but we are in the last 10 minutes of the discussion. So if you have questions, please share. And we'll make sure to address those. The next question I'll direct to Laurel. A common question I also get in my stroke clinic is, what are the supplements that I can take? Isn't there something over the counter that I can take that can help me with this stroke recovery? Like, what's the magic, supplement that's available to help my brain improve after a stroke?
Yeah, I get that question a lot in my clinic as well. And even sometimes we'll have patients come in with a big plastic grocery bag of just bottles and bottles of different supplements. And there's a few different concerns. I think nothing wrong with taking a multivitamin. Sometimes people have trouble getting enough fiber and they'll put, some fiber in, but really most of your nutrients should be coming from whole food sources. And that is the best way to get those nutrients. I mentioned earlier that the supplement industry is not really well regulated. So there have been instances where, what's advertised on the bottle is not necessarily what you're actually getting. I've had some patients, particularly with energy supplements or weight loss supplements, that are being marketed as all natural and very wholesome and sort of vitamin driven. When you actually look at the ingredients, I've had young patients come in with strokes, and then I look at what they're taking at home for supplements, and they may have phentermine in them, which some of us that remember back in the 90s, fen was a combo diet pill that got outlawed. They broke the ingredients apart, and the phentermine still shows up all the time in these various kind of direct to consumer marketed supplements. And so just be real careful what you're putting in your body with these over the counter supplements. You're much better off eating a bowl of spinach, having some berries, getting a slice of salmon, and getting your nutrients from actual food sources, both because of the reliability, the absorbability of those nutrients, and also because, as Daphne mentioned earlier, it's not just one nutrient that is sort of a magic button that you can push. It's a holistic approach, and it's getting all the nutrients together, and your ability to absorb those nutrients is sometimes better if you're eating them with other food components. So certain nutrients actually absorb better when they're eaten with fats. Other ones are absorbed better when they're in conjunction with other nutrients, and sometimes they block each other. One of the ones that I'll see, it's not stroke related per se, but you'll see people during cold and flu season, we're up in the Midwest and it's snowy, they'll be loading up on these vitamin C supplements with a lot of zinc in them, and they're just downing all this zinc because they think it's going to protect them from getting a cold, and the zinc actually blocks the absorption of copper. And so you'll sometimes see patients come in and they'll develop neuropathy. Their hands and their feet will be going numb. And you realize that they've been really taking these mega doses, sort of doses of vitamins and minerals that are not biologically realistic. And they're actually blocking their ability to absorb other critical nutrients. That concern when you're eating actual food, it's pretty minimum, right? When you're eating these supplements, you've got to be careful, because if you look on the label, sometimes it'll be like 5,000% the recommended daily value of something. What does that mean? Has that been studied? You're much better off actually just eating the whole food source of getting those nutrients.
Oh my goodness. Do we have time, Erica, for one more question, or what do you think?
I think we can squeeze in one more.
Okay. I was just going to loop in Jessica Hooke again, back to the patient and the caregiver. Because I can imagine sometimes it might be tempting easy to think, oh, a boost shake is all you need. Maybe that'll take care of a whole meal or something like that. But what do you actually do? How do you advise caregivers when they're needing to plan and prepare meals for stroke survivors? And those stroke survivors have mechanical deficits, have cognitive deficits. So how do you take all of this and then help the patient?
Yeah, so I'll tell you what I've done. I'll put in a little bit about the initiative. Is part of that came from seeing the patients and the struggles they've had because of their communication, whether they have aphasia or cognitive deficits, and trying to grasp this life-changing reality on top of the nutrition standpoint. So a couple things what I've done is incorporate into my therapy sessions. I've worked with dietitians and we looked at carb counting and looked at how does it look to if you have diabetes, which is huge. How does that look to look at the plate and determine what you need? And so we've created cards for them to, like, work on their cognition and to implement that. We've worked on it from a memory standpoint, family members. Handouts oftentimes is one thing, but being practical and getting to the kitchen is another thing. So we take them to the kitchen. We have them, like family members included, have the family members and say, hey, we're going to do this. Can you bring in a meal so we can, use that not just with dysphagia, but to incorporate that aspect. So I think it gets incorporated any type of way we can. In terms of like getting them out and know what to do when they leave. So that's where the dinner outings came in, and we took them to restaurants to see how they were planning and looking at their meals is another practical way, which is how I saw the struggles. Create this initiative to make it more inclusive with the food, adaptive utensils, quiet time, quiet hours, and picture menus. But one thing we have on there is not to just promote people going out to eat, but there's cards on there, and I've worked with dietitians to show different culturally relevant food options and how does that look for heart healthy diets? How does that look for a brain health diet? How does that plate look for someone who has diabetes and needs to regulate their sugars? And so they have a visual now to look at, and so that they can look at that plate, kind of like what Daphne was saying, and to have an example to go home for. Because sometimes the more we talk, especially in the early stages, it's hard. It's extremely hard to take in all that information. So my thing is seeing it, doing it, hearing it, any aspects we have to help them, but also giving them the resources later on. Because as we just said, our short window of being with them in a hospital is very short in terms of the expand of what happens when they leave. So the more we can provide for them when they leave, and like in places in the community that they can continue getting information and continue to have access to the community, that's where we can make those changes. So those are my different type of ways. And again, I will put that plug in terms of when there's that especially that cognitive aspect, and we need to talk a lot to the caregiver, providing those resources like the stroke associations, like online, their menus, breaking it down to them and show them how to change it to being culturally relevant for them also at the same time.
Thank you. And Marielle's bringing up the slide. That will conclude our webinar discussion today. Thank you to all of our panelists. Thank you to my co-moderator. Thank you to all of the people who attended with us today. Like I said, we'll make the recording available and some of these resources available through our CONNECT website. So here's the website, CONNECT. As I mentioned before, this is a collaboration to improve outcomes, preventive care, and care transitions after stroke. So it's a multidisciplinary research collaboration to improve post-stroke care and try to create more guidelines behind post-stroke care and transitions of care. So if you're interested in learning more about that, please come to our website, send in your contact information, and we'll keep you posted when we have future webinars. So you can join us again in the future and participate in our conferences. Thank you again to everyone. And with that, we'll wrap up. Everyone have a good rest of your day.
Mm-hmm.